Good. Okay. Today I'm seated outside the Fountain of Hope Treatment Center in Syokimau. Actually, I was seeing patients inside when I received a call from a family member who was inquiring about our services. And she had an interesting question to ask. She said, Doctor, I've found your center when browsing the internet, and I would like to know more about you. But specifically, I would like to know, are you good? How good are you? And how can I be sure that what you say on the internet is the truth? So we talked a bit, and then I said afterwards, let me make a video that can help other people who have such questions. So today I would like to answer this question. How would you, as a person out there looking for rehabilitation for your loved one, how would you know that this is a good rehab or it is not? Well, there is no magic, but there are some pointers that can help you identify a good rehabilitation center or a hospital for someone who you like treated for addiction to drugs or alcohol. And I would like to go through just a few of them in general without focusing on our center. And one day, if you come here, you may ask what the doctor said, does it apply to the center he works in or not? I'll leave that to you. But generally, there are two areas you like to look at when you are looking for a good rehabilitation center or hospital for your family member who is in addiction to drugs and alcohol. There are what I can categorize as external things and internal things. Now quickly just go through over them so that they help you as you go along in your search. From the external, as they say, first impressions count. And so if you go to a place and it looks good, you feel good about how the place is and it's presenting itself, that impression counts. And this is true also for rehabilitation center. So the external appearance would count for something, and not just how it looks, but a few important pertinent things about the externalities of this center that you are looking at, or this hospital. First, where is it located? A good center, rehabilitation center, hospital needs to be located in a place that is quiet, serene, different from the cacophony, the noise, the commotion that usually surrounds people in addiction. So you don't want to be in a rehabilitation center that has noises around, probably a pub, a public road that is very busy, a market, because out there we have people who are still indulging in drugs and alcohol, and they are going to create a distraction. What they say, the music you hear, the smell coming from people smoking around as they pass on the road, that is not going to be good. So a serene, quiet place would be an important place. Another thing to look at is, is it located in a place where you have enough space to engage in the many things that need to go on inside the center? Remember, someone in rehabilitation is going to stay there for 3 months on average by our Kenyan standards, sometimes longer. So this center, this hospital needs to have enough space to have activities beyond just the classical rehabilitation. And I'm talking about outdoor activities, recreational activities, extracurricular activities, so that the more that the people who are inside, the patients, are engaged, the better for their healing, for their mental well-being. Some facilities even have got space to put up activities for skills learning, like enterprise, like workshops. Some even have farms. Some have places people can learn extra skills while they are there. Those things are important. If you get them, go for them. Also, look at the security situation of this center. Remember, someone in addiction may not be willing to go into rehabilitation, and you may have to push them into it. So if they go to a place that's not well secured, they can escape. Also, their friends, other people may come in and bring drugs. So you may find that you are treating someone, but again, they're accessing the very drugs, the alcohol you are treating them against. You don't want that just because the security is lax and it's not good. Then also, about security, you want a place where the security arrangement is such that they screen thoroughly who comes in, who goes out, the things that come in, the things that go out, so that you don't get bad people, those old friends this family member of yours has been drinking with, coming in and trying to discourage him or her from continuing with the treatment that's going on. Or you don't want a place where people bring in contraband, cigarettes, alcohol, and many other things. Another thing to look at from the first impression, external things before you go inside, is just the sense of cleanliness. How clean is this place? You want a serene place, but it also should be clean. Because remember, people in rehabilitation sometimes go so low until self-care, cleanliness, taking care of their space becomes a problem. So if you go to a rehabilitation center that looks shabby, then it means the owners, the operators, the staff do not focus on cleanliness, and so they may not put importance to that aspect of rehabilitation, which we know is very important as part of rehabilitation. Look also at the number of patients in the center. A good rehabilitation center will aim to have a manageable number so that they can have that one-on-one approach to therapy, which I'll talk about shortly when I talk about internal things and programs. But if you have a rehabilitation center that has so many people, so many patients, then sometimes others just fall through the gaps, others just go through the motions, and they are forgotten. You find the proactive ones, the motivated ones, those who want to change are the ones who will benefit, but the others are just passengers. So the number is important in relation to the size of the rehabilitation center, the staff, and all the things you consider are important for keeping that number that you see in the center comfortable and well catered for. Look also at the diet. Go and ask about what these people eat, because when people are in rehabilitation, it's a restoration of the health of their mind, their body, and their soul. Most people in addiction have also a problem of poor eating, poor diet, they suffer malnutrition. So if you find a center that has got a good diet, that means that these people are wholesome in their rehabilitation approach, and that is important. Also, in this balanced diet, remember, it has to be balanced so that it steers away the people who are in treatment from the diet they have been used to. Most people in alcoholism, for example, eat a lot of meat, and sometimes that diet becomes unbalanced because it's steered towards one thing. They have appetite for other things, another thing is missing. You don't want that. You want a balanced diet as part of the plan that you are looking for to choose a rehabilitation. Then beyond those external things I've mentioned, you go inside, talk to the staff, ask them questions so that you know how the internal program is. And in this area of the internal, you want to understand a bit more about the program. Okay, you're not a specialist, you are not an expert in this area, but you can have a rough idea about what is happening. Good programs for rehabilitation are generally programs that are mixed. Presently, we emphasize more on mixed programs as opposed to programs that are steered towards one direction. I get, for example, calls from people asking me, when they are there, what do you do for them? Mnawafanyia nini? Do you pray for them, or do you just talk to them? Do you give them any medicine? These people are asking about the programs that run inside there. And I answer them that we do all of the things you're asking about and some that you have not asked. So in short, I'll be telling them that we use a mixed program, and a mixed program is where you find all the approaches that have been shown to work are being used, and the programs then will focus on the recovery of the body, the mind, and the soul. There's spirituality in there, there's psychological approaches, the talking to them, to counseling, all those are there. There are the medical things, the injections, the medicines people are asking about, all of them are incorporated into a comprehensive program for recovery. Also, to do with the program, Look at the daily schedule. When these people are in rehabilitation and they stay there for 3 months or whatever period, what do they do from the time they wake up to the time they sleep? That will let you know how occupied these people are and how comprehensive this program is. If you find a program that is well laid out, occupying them throughout the day, that's a good program compared to one that has many gaps, because when there are gaps, then you ask yourself, during this period of gap, what are they doing? If it's not lunchtime, they are not eating, and there's this long gap, what do they do? And you may be told they just stay around, do their own things. That means they are not very well occupied, because probably the program that's being used in that center may not be good. Also, on the program, look at the duration of treatment. What duration does this center employ? A good rehabilitation takes time. In Kenya, on average, NACADA, our regulatory agency, talks about 3 months. In some countries, it's much longer. But the important message is that if you go to a center that is promising to give you a result in a very short time, we'll just give them an injection or we'll just do something, and within a short time, a week, a month, they are okay. Probably they are not telling you the truth, because evidence, science has shown that rehabilitation takes time, and so the program must be of a reasonable duration for it to be a good program. Look also at the staffing levels in that center. Ask questions. Who are the people who take care of this? Are they nurses? Are they doctors? Are they counselors? Who are they? A good rehabilitation center or hospital will have all of the following categories. You have medical people, doctors and nurses, psychiatrists, you have psychologists, you have counselors, you have social workers, as well as support staff who help cooking, security, and all the other things. I'm just greeting a doctor friend of mine who's coming to see a patient. So look for those staff to be present for you to know that your family member will be well catered for. Because people who are in addiction sometimes have mental health problems. In a previous video, I said mental health problems and addiction sometimes are like Siamese twins. So if you go to a center where all the specialists are there to take care of mental health problems, psychological problems, social problems, spiritual problems, then you have a good center. Look for that as you shop for your rehab for your loved one. Look also internally at the cost of treatment. This is an interesting area. I get questions, how much do you charge? And some people say, it's expensive, can you reduce for me? And I tell them, well, we can do this, but we cannot do this because of these financial matters. What I would say, without going into the details of what we do, because this is not about Fountain of Hope, my center, it's about general rehabilitation. A good rehabilitation center will charge a fee that is reasonable for the cost of living that obtains in the country or in the locality. Because remember, the patient in rehabilitation will stay. So they will eat, they will board. There's a hotel aspect about the rehabilitation. They will get medication. They will be seen by doctors, nurses, psychologists, and these people need to be paid. This medication need to be purchased. So if a rehabilitation center is charging what looks cheap, ask yourself, how do they manage? How do they buy food? How do they pay for electricity bills? How do they pay for the doctors, nurses, and counselors here there? The security people who are supposed to make sure that everything is okay and no contraband comes into the center. So if it is too cheap, probably there are shortcuts people are taking which you would not want, because they will defeat the purpose of rehabilitation. If, on the other hand, it's very expensive, well, if you can afford it, no problem. But if you can't, don't just go for very expensive rehabilitation because of the cost. You may just be paying for luxury for a hotel. Like someone is staying in a 5-star hotel. That is good to stay in a 5-star hotel. But look, this person is sick. They have gone for treatment. They have not gone for 5-star hotel services. So if you can afford them, fine. But if you can't, don't worry about them. Focus on the real thing that matters, which is the treatment of the patient. Also, as you look at the internal programs, inquire about the involvement of you as a family member. Are you just being asked to bring your loved one and then go? You will come to pick them on the day of discharge? If that's the case, that's not a good rehabilitation center. Good rehabilitation requires deep involvement of the family, because people in addiction suffer from problems, some of them which are social, psychologically involving the family. And so if the family is not going to come in and try to find a solution to these problems because they are not being involved, then probably nothing is being done about that problem. And when this person leaves a rehabilitation center and goes out, the stressors within the family, the conflicts within the family that made them maybe go overboard and start abusing drugs and alcohol will reemerge because they were not solved, and the person will relapse into addiction. So the more the involvement, the better the center. Look also at the code of conduct that is in that center for the patients who are there. What are the rules and regulations? What are they supposed to do? What are they not supposed to do? A good center has got strict and clear rules. You can do this, you can do this. You wake up at this time, you sleep at this time. You can use this, you can't use this. You can be here, you can't be here. If you find a center where people are just allowed to do anything, then it's probably because not much is going on, and that center will not be good for the recovery of your patient, because we know that in rehabilitation, discipline or reinforcing of discipline among the people who are in the center, the patients, is important, because addiction makes you lose discipline about your life. You do anything anyhowly, you spend money anytime anyhowly, and so in rehabilitation this needs to be reversed. You go back to a disciplined way of living, and that will show in how that center emphasizes and ensures that they have an orderly and disciplined way of doing this. I would like to stop there. There are a few more things that probably you may look at, but I'll talk about that in another video. For now, I hope those few things about the external features and the internal workings of the rehabilitation center you are checking will help you make a decision about where to take your loved one for rehabilitation. Thank you. Bye-bye.